This advanced practice role presentation is about certified nurse midwives. It is done by Judy Birkmeyer, Maurice Blackbird, Alyssa Donay, and Madison Dibert Jones. What is a certified nurse midwife? According to the American College of Nurse Midwives, a certified nurse midwife is a registered nurse with advanced training to provide care as a midwife. Midwives deliver infants and provide newborn care for the first 28 days of their lives. They also provide prenatal and postpartum care, as well as well woman care. In order to become a certified nurse midwife, there are some requirements. First, you must have an active registered nurse license. Next, you must receive a graduate level education, at minimum, a Master's of Science in Nursing, with a focus on midwifery accredited by the Accreditation Commission for Midwifery Education. You will also need to pass the National Certification Exam administered by the American Midwifery Certification Board to be designated as a certified nurse midwife. Another common question is, where can certified nurse midwives work? They can work in hospitals, usually on the OB floors. They can have private practices. They can work in OB/GYN clinics, also seen in birthing centers, and they also offer home birth services. Another common question is, what is the scope of practice for a certified nurse midwife, and what range of services do they have for women? They offer OB/GYN, family planning, care for newborns within the first 28 days of their lives, sexually transmitted infection treatment for both the women and their partners. They offer care throughout the entire pregnancy. They also offer postpartum care, well woman services such as PAPs and contraception, health promotion and disease prevention. They can order diagnostic tests, and they can also prescribe medications, including controlled substances. Certified nurse midwives have 7 core competencies: direct clinical practice, guidance and coaching of patients, families, and other care providers, consultation, evidence-based practice, leadership, collaboration, and ethical decision-making. We will learn about each of these 7 core competencies on the following slides. Primary care is included in the core competencies of the clinical nurse midwife. Midwives demonstrate high levels of expertise in assessment, diagnosis, and treatment throughout women's life cycle events. They provide primary care for newborns and women through premenarche through the postmenopausal phases. Certified nurse midwives form partnerships with women to empower them to become active participants in their own healthcare. Certified nurse midwives also incorporate scientific evidence into clinical practice and have a holistic approach to healthcare. Nurse midwives are also important in providing assistance through the life transitions such as illness, childbearing, and bereavement. They provide guidance and counseling through the nurse midwifery management process. Client education is an important factor in midwifery. CNMs also educate the client on tests that need to be done, the process of how the test is conducted, what the results may indicate, if further testing is needed, as well as the risks and benefits to the testing. CNMs act as consultants and as consultees in practice. CNMs are consulted by patients regarding healthcare and health promotion. They are often consult with other experts such as physical therapists, massage therapists, hematologists, and collaborating physicians to help provide the best care for the patient. CNMs also provide consultation to students, physicians, and nurses. Nurse midwives are choosing to further their education with the development of the DNP and PhD programs. This leads to advanced research, theory development, and evidence-based practice that enhances patient care. The ACNM has incorporated research as a core competency to their foundation documents. CNMs are charged with incorporating scientific evidence into clinical practice in order to evaluate, apply, interpret, and collaborate in research. Leadership skills are another core competency for nurse midwives. Leadership skills are considered professional responsibilities for the nurse midwife. DNP prepared nurse midwives receive additional education and training regarding leadership within organizations and systems. Nurse midwives are expected to exercise leadership for the benefit of women, infants, and families. Nurse midwives have the ability to improve patient and population health through interprofessional collaboration. In a statement from the ACNM in 2014, midwifery management is independent and primarily intended for healthy women. However, collaborative management or physician referrals may be appropriate to provide the best care for the patient should complications occur. Nurse midwives often collaborate with physicians, OBGYNs, and doulas. Effective communication is essential for ongoing collaborative care of the patient. Ethical midwifery practice is doing the right thing for the right reason. Code of ethics guide moral behavior and are part of criteria that makes a practice a profession. The ACNM has 3 mandates for their code of ethics that are covered in the core competencies for basic midwifery practice. First is directed towards the individual woman and her family. Second mandate is directed to all women and their families. The third mandate is directed to the profession of midwifery. Midwives create partnerships with women, ensure that they have the autonomy to make informed choices about their healthcare. There are 8 standards for the practice of midwifery. Standard 1. Midwifery care is provided by qualified practitioners. Standard 2. Midwifery care occurs in a safe environment within the context of family, community, and a system of healthcare. Standard 3. Midwifery care supports individual rights and self-determination within boundaries of safety. Standard 4. Midwifery care is composed of knowledge, skills, and judgments that foster the delivery of safe, satisfying, and culturally competent care. Standard 5. Midwifery care is based on knowledge, skills, and judgments reflected in written practice guidelines that are used to guide the scope of midwifery care and services provided to patients. Standard 6. Midwifery care is documented in a format that is accessible and complete. Standard 7. Midwifery care is evaluated according to an established program for quality management that includes a plan to identify and resolve problems. Standard 8. Midwifery practice may be expanded beyond the ACNM core competencies to incorporate new procedures that improve care for women and their families. Being a certified nurse midwife comes with many challenges. In the next couple slides, we will be talking about their image, professional liability, and the quality and safety factors. The first challenge we would like to talk to you about is image. Some people believe that midwives lack educational credentials and that they can only help those who want to deliver at home. This, as we have learned, is not true, and midwives can be utilized in both the home setting and hospitals. Some people also believe that a midwife is something of the past and not something that is available to them now. The ACNM is moving forward in support of midwives by expanding access to midwifery care to all women. Consumer outreach, including both Healthy Birth Initiatives and ACNM, produced videos in support of midwives, which showed promotional videos of midwives providing care in multiple settings. These videos are helping every day to educate patients on ways that midwives can help them. The second challenge we would like to talk about is professional liability. The liability insurance rates are higher for midwives than those for other advanced practice registered nurses because of the malpractice climate of maternity care. One study found that 32% of respondents had been named in at least one lawsuit. A common phrase in midwifery is tort reform, which is a law set in place that caps non-economic damages. It limits the number of years in which a patient can file healthcare liability action. It places reasonable limits on punitive damage and expands alternative dispute resolution methods. The ACNM has also put together a professional liability packet that helps keep nurse midwives updated on the current issues and also helps to emphasize the quality and safety in practice and risk management strategies to help prevent adverse reactions. The ACNM also seeks to ensure that midwives have a medical and insurance option with a strong underwriter and national coverage, which is endorsed by the professional organization. The third challenge we want to talk about is quality and safety, which are very important topics to nurse midwives and the ACNM. In order to keep up to date on quality and safety measures, the ACNM has become core members in both the Alliance for Innovation on Maternal Health Programs and the Council on Patient Safety in Women's Healthcare. The Alliance for Innovation on Maternal Health Program is dedicated to reducing maternal mortality, improving postpartum care, and provides resources for consistency in providing well-woman care in the United States. The Council on Patient Safety in Women's Healthcare focuses on providing information to members of collaborating organizations to provide safe care to every woman. It has also been found in a recent review that midwife-led care models result in fewer medical interventions, greater maternal satisfaction, and have noted trends toward lower costs with outcomes at least equivalent to other care models. Now we will look at the changes and future outlook of the certified nurse midwife. In the United States, 46% of counties have no access to OBGYN care, and 56% are also lacking access to certified nurse midwives. With an increasing number of women of childbearing age, as well as increasing number of births, this is an alarming amount of people that do not have access to maternal care. Certified nurse midwives are capable of providing prenatal care, preconception care, care throughout birth, and newborn care. The future of certified nurse midwives allows for practice of full scope in order to bridge gaps in care due to inadequate number of physicians. With increased scope of practice, more women are able to receive the care needed in order to provide a more safe childbirth and immediate newborn cares. This will be especially important in those rural communities. Another added benefit of using CNMs to bridge the gap of care is reduced cost of healthcare. In low-risk births, the use of certified nurse midwives compared to a OBGYN resulted in a decreased length of stay, decreased use of birth interventions such as cesarean delivery, vacuum assist delivery, and epidurals, and decreased overall cost. The future of the certified nurse midwife role is going to depend greatly on healthcare facilities utilizing these midwives to their full scope of practice. As for potential changes similar to the nurse practitioner program, it is likely that they will soon transfer to a doctorate program rather than the master's that many CNMs are pursuing now. Other changes could be related to increasing scope of practice, such as increased responsibilities and opportunities for certified nurse midwives to care for an increasing number of patients. We would like to thank you for taking the time out of your day to listen to our presentation about certified nurse midwives and what they can do for healthcare facilities and for you.